Good morning, everyone, and welcome to another very exciting episode of Ben's Den. And this episode is extra special because our guest is Dr. Stephen Lane, Chief Medical Officer of Health Gorilla and a renowned voice, a trusted guide to interoperability in our industry, and somebody that I have looked up to since the day I met him. Very inspirational, a guide, a mentor. Things that I learned from him are absolutely mind-blowing. So, Dr. Lane, thank you so much for being part of our my podcast today, and welcome.
Thank you, Pranam. I'm excited to be here. Let's jump in.
Doctor, why don't we start with, if you can give our audience a little bit of your background on you, your work, the work you've done to date, and what your current focus is. That'll be good to get started here.
Sure. So briefly, I'm a practicing primary care physician. I'm a family doctor. I've been doing this work for nearly 40 years now. And I've also been in the health IT space for almost as long. It was over 35 years ago when I was moonlighting as an ER doc during the end of my residency that I had the chance to use my first electronic medical record. It was a few first generation Macintosh computers strung together with Ethernet cable. And it was a local record that we used in the ER so that we could actually find each other's notes and read them and document. And it opened my mind to the possibilities of digitizing healthcare, of actually having data that could be analyzed, that could be used to take better care of patients, of individuals, as well as populations. So fast forward, 35 years, the world has changed tremendously. I mean, I just came off a webinar where I was learning about the latest implementations of AI chart summarization and decision support tools and how we can, use these tools. So I've been here through the whole thing, through first EMRs, rolling those out across specialties, across care settings. And then my focus for the past 20 years has been on interoperability, on how do we move data between organizations, between stakeholders, from providers to payers to patients, so that we can actually start to feel the experience, to experience the benefits of all of this digitization that we've done. And it's, people lament that it's taken us so long to digitize healthcare, that we haven't completely solved interoperability. We haven't completely gleaned all of the value, that our industry has been slower than, say, telecom or finance. But the reality is that we have a very complicated set of things to do, right? Healthcare is complex, human health, human emotions, human society, all of this comes into play. But the barriers today are largely operational. They are policy related. They are coming to agreement of how we're going to do things and how to prioritize them. They're not technical. We have digitized the system. We've laid the pipes for data exchange. We know how to move data around. And now we are on the cusp of the next revolution in healthcare, leveraging data to support these new AI tools, large language models, et cetera, to be able to do more comprehensive analytics and really gain the actionable insights at both the individual and the population level. So I'm thrilled to be here with you, Pranam, because you guys you get it. You totally understand the value and the opportunity, and you're doing what it takes to move us forward.
Dr. Lin, thank you so much. That's such a fascinating background and explains a lot of your passion in the things that you do. And the fact that you're a clinician leading the charge is just absolutely amazing for all of us that are participating in this work. Let's talk about interoperability. From my perspective, it's the oldest problem that we've known in healthcare. But at the same time, I also feel in the last 5 years, we've made more progress than the last 3 decades in enabling data to flow. So how do you look at the current state of interoperability and specifically Health Gorilla's role? Because we are a staunch believer in Health Gorilla's work. I mean, we've partnered with you guys. We champion your cause wherever we go in the work that we do on a daily basis. So talk to us a little bit about how do you see the industry at large in terms of where we are in interoperability and specifically Health Gorilla's role in that evolution, in that journey?
Sure. So interoperability, of course, as I said, goes back a good 20 plus years, right? Yeah. It started with intraoperability, right? How you connect the systems within, specifically within a healthcare system or within a payer system so that you can deal with your internal data. And then we started connecting across health systems. And of course, we created interfaces, from payers to providers to public health, et cetera. But it was all very disparate. And what we've done over the last couple of decades is we've really worked to standardize interoperability, to develop technical technical standards, to develop operational standards, to develop data standards, and to really get a more ubiquitous implementation. So I was part of implementing the very first vendor-based networks. There was the Epic Care Everywhere network, the Commonwealth network, and then we put together Care Equality, which was the first nationwide framework that allowed those networks to exchange data. And then what we found is that we could only go so far. So then with the 21st Century Cures Act, the federal government determined that we needed to have a TEFCA, a Trusted Exchange Framework and Common Agreement for the country. So that was the next iteration. It was really built on the model that we developed within Care Equality, but it's gone so much further. But it's still the case that the vast majority of data exchanges for the treatment exchange purpose. Treatment was initially defined in HIPAA decades ago. It was a fairly vague and ambiguous definition, and it has led to some coloring outside the lines. Since most responders only respond for treatment, people have taken a broad interpretation of treatment, and that's gotten us into some trouble. So within TEFCA, we're narrowing the definition of the treatment exchange purpose, and we're also working very hard to stand up other exchange purposes. So individual access services for patients to collect their own data and determine where it goes, already covered in HIPAA, but much more specific under TEFCA. Healthcare operations, as you know, so much of what we do in healthcare today, especially at the population level, is really operational. It's not an individual provider working with an individual patient on a treatment problem. Payment, of course, we've developed myriad ways to move data around between payers and providers to manage all the different components of payment, including prior authorization. But they're not consistent, they're inefficient, they're incredibly expensive, and add to the terrible problem we have with healthcare costs in this country. And then government benefits determination, research. There are many other use cases where there is appropriate legal need to access data, and we make it very hard for people. So the idea with the TEFCA is to develop a standard that can be used by any stakeholder, by patients, providers, payers, public health, community organizations, whoever's involved in the healthcare process, and that they can use these same standards, these same rails. And now where are we today? Well, we've done this tremendous amount of work as an industry over decades. It's really built on itself. We've developed and refined the standards. We know what needs to be done next. And now we have a new administration that has potentially new priorities or a new focus of how we're going to do things, a big focus on cost savings. Of course, cost savings can be huge with interoperability done right. Just to summarize, I think of interoperability as the only tool we have in our medical toolkit that can simultaneously address all 5 pillars of the quintuple aim. It can improve the health of the population. It can lower the per capita cost. It can improve the patient experience, the provider experience, and allow us to give equitable care across the population. There's no medicine, there's no surgery, there's no healthcare arrangement that will do all 5 of those things, but interoperability will.
Absolutely, Dr. Lee. In fact, we've absorbed this fundamental philosophy of a data-first approach to empowering quintuple aim. And we look at ourselves as a platform that empowers that. But in everything we do, we've adopted a data-first approach, regardless of how complicated and how difficult that challenge may be. But we are committed to it. Now let's talk about something that is very important, which is what matters is the actions that are driven by data. Making data available is only half of the battle. How are you empowering appropriate, timely decision-making and actions that are tied to that decisions, so that the ultimate beneficiary, the patient, experiences the benefits of the interoperability backbone, right?
So there's no question.
So what are the barriers for that? Obviously, we are still very early in that, and we see that because when we work with providers, we are the endpoint, right? We are working with providers, we are enabling data and giving them the tool set. We see a lot of frictions at the endpoint. It could be stakeholder alignment, it could be contextualizing the data, cleansing the data. There's a lot of things that come into play at that point, right? So how do you see it? How do you see we overcoming these barriers that we're dealing with today?
So as we said, first we had to digitize the information.
Records,
Then we had to exchange the information.
Right.
We need to bring it together in a way that you can then develop actionable insights. That's a term that I love because, but then you need the action arm of that. How do you take those insights, get them in front of the appropriate effector, if you will, whether that's getting them in front of a human being so that they can cognitively perceive what needs to be done and make a human decision, whether it means getting them in front of an algorithm or an agent that can then make that decision. So part of the barriers are still data access, getting as much of the appropriate data as is possible. Part of the barriers is having smart people, agents, analytical tools that can then act on that data. And then saying, well, what are the tools that we can use to actually make a difference, right? Whether it is a decision support alert, whether it is an outreach to an individual, whether it is identifying a population of patients that's at greater risk, and then having something that you do to effectuate better care. And then it's also having that feedback loop of saying, we found this, we did that, and this was the outcome. And then this process of continuously improving that. And I think, again, you see that, right? You understand the need to have, data, analytics, actions, and then continue that assessment. You were asking about Health Gorilla earlier, and I didn't really get into that. But of course, I'm Chief Medical Officer at Health Gorilla. I've been here almost 3 years now. And I came over to the industry side from the healthcare system side because I really thought that we needed to have a diversity of players in the QHIN ecosystem, so that not only the big EHRs, or other big vendors, but that you had entities acting as QHINs who were flexible, who could address the needs of these new populations like value-based care and population health management, which may or may not be the principal focus of some of the other established players. And, Health Gorilla's been very active. They jumped in and committed to becoming a QHIN when the Cures Act first came out, and had already been active within Care Equality and eHealth Exchange and Commonwealth and all of the other networks. So it's really been exciting to see, that there are actors like Health Gorilla within the ecosystem that have been able to move quickly, that have been able to develop the tech, been able to access the data. And, as we've been discussing, really looking at what is the opportunity with AI? How do we get, the right data, high quality data to the agents, be they individual human being agents or computerized agents that can then do the analysis and make those decisions.
So let's dig into that AI component of it a little bit, right? Because I feel in terms of the potential to harness data, I think AI-related technologies provide us the greatest opportunity we've seen ever in the entire evolution of tech in our industry, right? So when you have something as powerful as that, I think it warrants us to be more deliberate and cautious about how it gets applied, because when you can't control the movement, when there is unintended consequences, it's very difficult to control the reactions and the consequences of that, right? How are you in your personal work, wherever you're advocating for a lot of good things happening in the industry, how are you educating the community around the perils of the hype around AI and being very responsible in applying AI in healthcare? We have our own posture and document. We are very grounded on the realities, because the way we come at this is that our adoption of AI is always a evolution of something that has been well defined. We don't go into an unknown territory with AI in our world and say, hey, let AI do its thing. It's too risky in healthcare. Just because of the nature of the work we do, like I said, the nature of the consequences that can play out. And more importantly, I feel health needs to be more human-centric now than it's ever been. So you need AI to amplify that. How do you see that? How do you see AI and machine learning transforming the next 5 years of data adoption in our industry?
Yeah, I think it's a great question. And I think that the answers that you were proposing are very appropriate. The key with AI is that we can't move too quickly and we shouldn't move too slowly.
100%,
we want to be deliberative. We want to be cautious. We want to leverage the power of our community to be sure that we're going into this eyes wide open, that we're finding issues related to bias, that we're finding issues related to confabulation, that we're leveraging the tools in as responsible a manner as possible. The problem is that process takes time, to do formal evaluation, to publish peer-reviewed research. I mean, I was literally just, talking with a bunch of healthcare system leaders, and we were talking about how important it is to analyze the value of, say, AI chart summarization. But the problem is, by the time you do the analysis and you publish the data, you're already 2 generations behind on the AI, right? So you say, well, yeah, 2 years ago, this was the outcome. But, in a sense, that's true of everything in healthcare, right? There's always a certain lag time if you're going to analyze things carefully. I think the challenge is that there are always going to be people who want to implement AI or any technology, in a way to kind of make a quick buck, to make a splash, to make a name for themselves. And I think we have to be very cautious about that. There's
Right.
so much hype, as you say.
Right.
Now an AI can answer a patient's questions online. Now an AI can, tell me what drug to prescribe. Now an AI can do something else. And that's very exciting. But we have to always ask questions, show me the data. I think one of the things that is very exciting is that within the ONC rulemaking within the last couple of years was a requirement for certified health IT, which is mostly electronic health records, to have a certain degree of transparency around AI. When is AI being used? And then within those AI tools, having like a nutrition label that says this is the data it was looking at, this is the process it was using. Haven't really seen a lot of that implemented yet, and we don't know whether the new administration will maintain a focus on that. The role of AI in the industry, and the players that are making decisions now, we're waiting to see. I think we're waiting to see around health IT generally. We're waiting to see around interoperability. We're certainly waiting to see around AI. How much is there going to be, regulation and oversight? How much are we going to let the industry, drive this? But I think as key industry players, I think it's critically important that we maintain skepticism, but we also maintain an open mind. You have to both be innovating and pushing ahead, but also really watching the impact on the back end and identifying places where there are those unintended consequences, as you said, because we've seen that over and over with technology. Something comes out, the smartphone, the internet, the EMR, and we think, oh my gosh, this is going to solve all of our problems. And it does, we take 2 leaps forward, but then we say, whoa, it had these other effects. And we have to very quickly step back, adapt, and then figure out what the next step is.
Absolutely. And in fact, I think you're right. I think across the sector, we are in a wait and watch pattern right now with the new administration and I think a lot of things are being done in haste from my perspective. And I hope eventually things will settle down and common sense will prevail. That's the hope. And it's happened in the past as well. We've seen different, events that have caused knee-jerk reactions and then things settle down. So with that in mind, just to look into the near future, and since you have a view of things better than any one of us do, what do you see in the immediate horizon from TEFCA and other key regulatory initiatives around data interoperability, data exchange, Dr. Lim? Because when I got to know about TEFCA and I heard from you first and then I did my own research, I'm an absolute fan of what TEFCA is intended to do. I think TEFCA, when implemented, will be the backbone of what we need to allow for seamless healthcare to be democratized, right? In terms of TEFCA and then generally other initiatives that you have privy to, where are we today? What should we expect in the next few months?
As you say, we don't know. Decisions will come out of the administration that will really determine what that looks like. But I think it's very important to take stock of where we are. So TEFCA, as I said, is sort of an iteration on the care equality framework that we've had for a decade now. That framework is now supporting over 1 billion chart exchanges every month. I mean, we have tremendous traction and impact in the industry. I, as a provider, literally every time I see a patient, I have access to data beyond the walls of my institution. And this is really true across the board. That's where we're starting. But again, as I said, it's all for treatment. So what we're driving towards is really enabling the additional exchange purposes. That's been the big challenge in care equality, and it's the big promise in TEFCA. We are doing that at a time that we're also seeing advances in security, in data quality that's being exchanged, and all of those things are going to move us in the right direction. But again, the details of what is step A, B, C over these next few years, I think are going to be driven by the personality and the policies that we see coming into the health IT ecosystem writ large. I mean, I think that the industry players are well defined. I mean, there have been a number of attempts on the part of large technology companies to come in and redefine the field, and you've still got people, like Larry Ellison, who says, I've got a great idea. Let's just put all the data into one of my servers and, we'll solve everything. And, and that's been tried before. And, and all these initiatives will move forward, right? It's a chaos, but it's a beautiful chaos because you have so many creative minds trying new things all the time. And then the market, will respond. But we've seen market failures, right? We've seen market failures in terms of data blocking, in terms of data quality, where we need to create those business models. And I think the one that you have, population health management, value-based care, it's brilliant. What we know about healthcare is that when you do it well, it's cheaper and
Yeah.
people
And it
people
works.
are
Yeah.
healthier. There are so many forces within American healthcare in particular which have driven us to this point where our quality is low and our cost is high. There's so much opportunity to do better, right? And I think, and again, we have the tools, as we've said. Now we are about to look at this next period of time, and I think we need to create it together. I think that's the bottom line. It's likely going to be less driven by government directive and more driven by innovative people working together, collaborating in the industry to move us forward.
That's amazing, Dr. Lane. And I look forward to working with you and all the other stakeholders. We'll do our bit. We'll do everything that we need to ensure that change happens for the right reasons and it is data driven. Thank you so much, Dr. Lane. Thank you so much for taking the time to be with us this morning. I can't let you go unless I ask you the most difficult question of this podcast, which is a fun question. You ready?
Okay.
Okay. Let's say I'm a genie and I give you one medical superpower. With a snap of your finger, you can solve for one medical issue that is plaguing us. What would that be? You have a medical superpower. Just snap of your fingers. You can solve.
I'm going to double down on interoperability. I'm going to say, give me the opportunity to get the right data in front of the right person at the right time with the right workflows so that I can do a better job taking care of patients.
Awesome. Thank you so much, Dr. Lane. It speaks to your passion. And I think you already have that superpower. You're working on it. Just not a snap of your fingers.
It's just taking a while.
It takes a little bit longer.
Great to see you, Pranam.
If you enjoyed this episode, make sure you're subscribed to our channels. Episodes will be posted once a month with a variety of industry leaders, and you can follow us on LinkedIn, Twitter, and Facebook as a Garajan. Have a good one.